Sandhya to give me this opportunity to talk to you all from this platform. It's a great honor and privilege. But at the same time, let me tell you, today I am not talking to you as a gynecologist and obstetrician. Today I am talking to you about my story. Today I am telling you that I am a cancer survivor. Yes. You have heard me right. I am an ovarian cancer survivor, and in fact, when Sumitra called, thank you so much. When Sumitra called me up and she asked me कि Sandhya दीदी आप कुछ बताइए, that time only I decided that it's very important for everyone to know that my journey through cancer, it was long, it was exhaustive, it was very challenging, but still it taught me so many good lessons of life which I can never forget. It taught me about resilience, hope, compassion, and most importantly, after this cancer episode, my practice, my approach to patients, it has changed altogether. So let me tell you about my story. I am a cancer survivor, so please don't mess with me because cancer survivors are very tough. They are actual steel from inside. And it's always a mind game. Whether you want to live with the cancer, you want to win it, or you want to just curse your fate. What happened? What happened? So it's all about your positive mindset. Whenever someone suffers from cancer and decides to come out of it, then the whole destiny helps. My story begins in 2006. Actually, it was in 2004 when I underwent NDBH. Every gynecologist knows. For my non-medical friends, I am telling कि मेरा ऑपरेशन हुआ बच्चेदानी का, and that operation was done by Dr. Shah. He did my NDBH for multiple fibroids and adenomyosis. It was in 2004, and Dr. Shah, he is the father of NDBH. He did it in his hometown, Patan. I went there with my family. My operation was done. He did the job perfectly, and at that time there was no concept of prophylactic or opportunistic self-injectable. As a result, Dr. Shah, he told me, Sandhya Ben, तमारे दर वर्षे sonography करावी पड़से. Okay sir, I agreed. Everything was okay. And then in 2005, in the same month of April, when in 2004 my hysterectomy was done, I went for my routine sonography, abdominopelvic. It was okay, no problem. Then in 2006 April, I was super confident there cannot be anything, so I missed the opportunity. I didn't go for sonography. Then in the same year 2006, in August, on 14th, it was drizzling, less number of patients, so I decided to go for routine sonography. As soon as my friend, radiologist Devas, Dr. Ashala, she put the vaginal probe inside me, I could see आशा का चेहरा सफेद फाक. मैं समझ गई कुछ गड़बड़. She immediately called Neeraj, and then they did my color Doppler. It was a very vascular growth at the vault and left ovary. Stage 2 ovarian cancer because capsule was intact. Then we were very depressed, very frustrated, didn't understand what to do. We were back to our Khare nursing home, Devas, seeing 3-4 patients. And then in the evening, we were standing in front of Dr. Khare. He also did my sonography. And then Dr. Ravi Kusmakar, he also did my sonography. And they were all of the opinion that immediately my procedure should be done, my operation should be done. So the very next day, on 15th August, my surgery was planned. It was done by oncosurgeon Dr. Deepak Agrawal along with Dr. Khare. Just imagine, पूरे टाइम हम इतना पढ़ते हैं ओवेरियन कैंसर का, अपने यूजी में, पीजी में इतने सारे वाइवा देते हैं, इतने सारे स्पेसिमेन, बट आई कुड नेवर इमेजिन कि मुझे ही ओवेरियन कैंसर हो जाएगा. आई वॉज नॉट हैविंग एनी हाई रिस्क फॉर दैट. आई वॉज नॉट ओवरवेट. आई वॉज I delivered a baby boy, so I was not a nullipara. My age was, at that time it was 44, 45. There was no family history. There was no endometriosis, no diabetes, nothing, and my weight was also okay. So I was not having any Lynch syndrome or family history of ovarian cancer or breast cancer or endometrial cancer or whatever. So it was a shock to me. Actually, I didn't have any symptoms also. Like typically the patients, they tell us about the abdominal fullness, bloating, discomfort, loss of appetite or anything, but there was nothing. It was just a asymptomatic growth, and I just went for a routine sonography, though I went with some delay. So Dr. Deepak Agrawal, he did the procedure very nicely, and he did extensive vault excision, of course bilateral self-ing oophorectomy, pelvic lymphadenectomy, paracolic gutters, partial omentectomy, and in fact imprint cytology was also done, and finally my report came as poorly differentiated ovarian carcinoma. So what I want to tell you that cancer एक ऐसा शब्द है, when the news came to me in 2006, like this period, it was more than an earthquake for me, and it has shattered all my dreams and plans. That year, my son, who was selected for medical course, that time it was AITMT, so he was selected for Sion Hospital, Mumbai, and LTM Medical College, and he was the topper for that batch. He studied for 2 months only, and just at that time, 2-3 months before he was back, he said, I don't want to do medical course, I would do engineering. Both of us, me and my husband, Dr. Khare, we were very disheartened. But anyway, what to do, whatever children like, they will do, so we supported him. My daughter was only in class 4, and we were actually struggling to settle in Devas at that time. We were back from Dar es Salaam in 95, my husband joined in 96, we opened a nursing home in 98, and this happened in 2006. There was hardly any time. So I didn't understand how should I sail my ship through these storms. I was not knowing what will happen next moment. And that time my husband played a very vital role. He told me that darkness cannot drive out darkness, only light can do that. So he became a very strong positive force for me, and he supported me very well. He really handled me very nicely. He didn't allow me to become depressed. And Dr. Khare is such a meticulous person, but at that time, later on, I was told that during my investigations and all, he lost his purse once, and in 4-5 days of this investigations, treatment, surgery, diagnosis, surgery, he lost 5 kg weight. In fact, Dr. Gada asked him, Neeraj, you suffer from cancer or Sandhya? So it was a very bad time. So who built my courage other than Neeraj? My whole family. Actually, my mother-in-law, now she's no more with us, but she was a very pious soul, very good lady, very kind-hearted. She always handled me with care, and there was a definite role by my friends, and fortunately I met with all the doctors who were very supportive, and society of course helps us. During my chemotherapy, the first episode of chemotherapy was done, first course was done in Gokuldas Hospital. There Dr. Arun Agrawal, he told me that Dr. Sandhya, whatever problems you are going to get with chemotherapy, because chemotherapy is not so easy, lots of side effects. So he told me that, believe me, we are trying to deal with your micrometastasis throughout your body. And that thing, throughout my radiotherapy also echoed, and I always faced radiotherapy very nicely. Actually, in a case of ovarian cancer, normally radiotherapy is not recommended. But one of our close friend from Bhopal, he was a doctor, he qualified from Nanavati, Mumbai. He insisted, Sandhya ma'am, aapko to jana hi padega. He arranged for everything. So I took my radiotherapy 5 weeks course from Mumbai, Nanavati Hospital, and it was a good experience also and bad also. Good in a way that my radiotherapy was scheduled at 4 p.m. At 3 p.m. they would give me one cytoprotective injection. And my friend arranged in such a way that in the mornings I attended the gynae department and I was working as an observer over there. So it was really good that I was involved in something. Otherwise, throughout the day, you just keep thinking what will happen to me, how I will behave later on, what will be the sequelae of this radiotherapy and all that. So it was one way very good. And at that time, I became friendly with 3-4 PGs also, because those PGs were very supportive, very caring and very good. And in fact, one of them is still a good friend of mine, though she is much younger to me. But yes, she was a big support. And after radiotherapy, it was full of side effects. That time also, I was going for radiotherapy. I am sitting in a auto or in a bus, and there was severe intense feeling for diarrhea and tenesmus, vomiting, dyschezia, dark coloration of skin, so much of burning while passing motion, lots of side effects. But I remembered what was told to me by Dr. Arun Agarwal, that all this is for your betterment. And today I am really thanking God that I am standing in front of you and talking to you. It's all God's grace. One thing which I have learned through all this is self-care. Self-care isn't a luxury, it's a necessity. It's not being selfish, because we doctors, especially gynecologists, we forget the importance of self-care. We give every ounce of ourselves to our patients without thinking of anything, and that's how we have been told. We have been trained that patient first, and we agree to it. But we have to spend some time for ourselves also. We have to give the best care to ourselves also if we want to become the best caregiver. So I wanted to emphasize that please, please, please pause for a moment. Whatever you are doing, you might be very busy, but please take care of yourself. I also learned that one of the most important aspects for recovery or self-care is maintaining our physical health. All this we are telling our patients. All the time we are telling them about the healthy nutritious diet, exercise, everything. But do we take out 1 hour of us every day for our self-care? I think now it's high time we all should do it. We are telling our patients about the prevention of cervical cancer, breast cancer. We are doing CMEs and practically we are going for camps and everything, and we are telling them. But one question, how many of us ourselves went for LBC and HPV, which we are doing for cervical cancer prevention? Most of the time we forget. While cervical cancer gives us 10-15 years before the actual disease happens. So not that everything is for the patients. These care modules, they apply for us also. Breast cancer, you know what happened after my this episode, or what do you call journey? Now any patient who is beyond 40 years of age or any younger, they enter my chamber, then I try to counsel them for the self breast examination. In fact, many of our relatives, young girls, I have told them that in your internet time, take out some time to see how to do the self breast examination. So I tell them, do it 20 to 40 years of age, do it once a month on fixed day, and then once a year the clinical breast examination, and then every 3 years mammography. You won't believe, recently we have got a group of gynecologists and other lady doctors in Devas. So recently one of the doctor, Dr. Prachi Maheshwari, she kept on insisting that auntie aap sabko mammography karani hai. She used to phone us in the morning, afternoon, evening, and she made sure that all 16-18 ladies of that club, we all underwent mammography. Fortunately, all of us had normal breasts and there was no problem. But if she didn't insist, we were not going for that. So that's what I want, that there is a definite role of prevention, early detection and proper and early management with qualified doctors, and I was very fortunate to have good team of doctors all the time. To my general public, whosoever comes with the diagnosis of cancer, I tell them that don't fall in trap of quacks and false claims, because such advertisements are everywhere. in the newspaper and other places also. So they should go and see the proper doctor. That is very important. None of us want to suffer from cancer, but suppose it happens, then what? So my message for everyone, believe in God and yourself. You will come out of it, definitely. I did the same. Physical fitness is very, very important lifestyle modification which we all have to adopt. In that, all this we keep explaining our patients. We ask them to de-addict them if they are smoking or having addiction for alcohol. Moderation in alcohol in moderation is not bad, but smoking is bad in every sense. We want them about maintaining healthy weight. We tell them for exercise, but we hardly emphasize for sleep well. That is very, very important, because I advocate 6 to 8 hours of sleep for all adults. It's very important because during sleep so much of recovery happens. And in my own house, sleep habits of me and my husband, they are different. He doesn't want to sleep for more than 5 hours and I need for 7 hours or more. But I think that works because during sleep lot of recovery takes place. Now, mental and emotional health. Physical health is very important. We do it with exercise and all. But equal important is mental and emotional health. Because we as gynecologists, we are having such a demanding job. We are having so much of workload. We are having so much of emotional labor. If there is some difficult or complicated case comes in, and suppose I don't want her to go to immediately Indore, then I might talk to some doctor in Indore and manage her. So we are stressed out, and most importantly, all the time we are all in the on mode, ready to work. Right, that's okay. But we need to de-stress ourselves because of this stressful job. So how do we do that? We can do that with yoga, meditation, and even talking to our friends, having good time with friends. That also de-stresses us. Now, the role of friends and family in your recovery. I think most of you can recognize yourself in that group. So, the role of friends and family is really instrumental. They are the people, we need to have a crying shoulder. So, suppose we feel like during that time, if I was feeling very depressed, one of my friend, Dr. Maheshwari, unfortunately she is no more. She at that time was already diagnosed with breast cancer. She used to come to me, sit with me for 3 hours, 4 hours, and she will give her precious time to me, consoling me. And most of our friends, they help us. They make us realize that there is life after cancer also. So that's a very important role played by friends, because they can have dinner with us, they can be with us, they can just talk to us, or they can just allow us to cry for some time. But then they rebuild our courage again. This is my close family group, aerobics family, because we are attached to one aerobic club. And these are the members of that club. This is my mother-in-law. She was very nice, as I told you. And my son and my daughter, they were always supporting me. My daughter always, she was in class 4. Coming back from school, she will come to me first and she will say, Mama, aaj to ulti nahi hui, kuch khaya? Like that, she has become my dadi at that time. And big support from Dr. Neeraj, of course. So, my message is also for the power of antioxidants and supplements. Sometimes we skip meals, sometimes we have long working hours, long time in the clinic or in surgery or something. So we should carry something handy with us, and we should trust on these antioxidants. They also work in recovery, very important. And one message is for insurance or mediclaim, because today's generation is very intelligent. All of us, you must be having some kind of insurance, but I am telling you, when my cancer was diagnosed, we were not having any mediclaim. So we had to spend from the pocket. But we didn't compromise anywhere. But what I am telling you, nowadays, not only cancer, but any medical treatment is expensive, because there are many ways to get rid of it. So we need to be financially strong. That's why all of us should have a good policy coverage. The woods are lovely, dark and deep, but I have promises to keep, and miles to go before I sleep, and miles to go before I sleep. I used to see these celebrities. They recovered from cancer, then why not me? And in fact, this photo of Sonali Bendre, that inspired me. Because when chemotherapy started, immediately after 7-8 days, whenever I used to comb my hair, एक गुच्छा बालों का हाथ में आ गई, बहुत डिप्रेसिंग होता था. Then one day I called my barber and I asked him to clean shave my head so that when the new hair growth comes, it will be very good. And I was optimistic, and this was correct also, because when the new hair growth comes, that time you are already on lycopenes and antioxidants, good dose you are taking. So the new hair is very soft, silky and very nice. Power of empathy. After this cancer journey, I have understood that there is a definite difference between empathy and sympathy. Someone suffers from cancer, we have sympathy. But most of us know that empathy is altogether different. When we put our foot in their shoes, we understand their pain, we understand their problem, we understand their sufferings. So empathy is very good. Nowadays, my approach to patients has changed altogether. With cancer, my life changed by 180 degree. But now I see all patients through a different lens, full of empathy. So a call to action. Most importantly, we gynecologists, we are healers, we are the guides, and we are source of hopes for majority of our patients. So let's advocate for early detection and of course never to stop fighting for our patients. This is very important because we are the first line of defense against the diseases like cancer. एक कैंसर शब्द जो होता है ना, it not only involves the patient but the पूरी family affect हो जाती है, financially, emotionally, otherwise also सारे plans चौपट हो जाते हैं. तो मुझे लगता है कि our vigilance and expertise, we have to have a strong suspicion. We shouldn't allow any patient to develop cancer, and if at all it develops, we have to be very empathetic and very supportive for them, because in our hands we hold not just power to treat but also the power to transform lives. So that is because we are the first point of contact for any gynecological cancers. So if we do our job very nicely, sincerely, it's going to make a difference in the lives. Because yesterday in International Women's Day, the theme was accelerate the action. So how we are going to accelerate the action? We can change our approach. We will accelerate the action for prevention of any cancers and for good support once the cancer develops. So that's what we should pledge. My final message is, my journey with ovarian cancer has been a big challenge, but it also taught me the importance of resilience, hope and compassion, as I told you earlier. And I'm grateful to the care I received, and I'm honored to be speaking with you all today. Let's work together to make a difference in the lives of women affected by ovarian cancer. और मुझे ये भी लगता है कि मैंने जो आपसे कहा कि हमें अपनी केयर करना चाहिए. Whenever we travel by air, it's said that if there is any emergency landing, the oxygen mask will fall down and then you put your mask first. Why? तो दूसरे की जय से पहले हम अपनी जय करें, हम अपना पूरा ख्याल रखें, क्योंकि मुझे ऐसा लगता है कि लहरों से डरकर नौका पार नहीं होती, कोशिश करने वाले की हार नहीं होती. मंजिलें मिले या ना मिले, मंजिलें मिले या ना मिले, ये तो मुकद्दर की बात है, पर हम कोशिश ही ना करें, ये गलत बात है. I'm enjoying this second inning more than the first one, and I'm very happy with my husband, my family, and I'm very, very thankful to you all for patient hearing. Thank you very much.